Assalamu alaikum. I'm Dr. Tahira. Our program is Health is Wealth and we are at PTV World. Today we are present here with hepatologist and gastroenterologist Dr. Omar Hassaan Aftab. We are discussing gut health. Our gut is extremely important because it determines how we think and how we think determines how our gut works. So to fight IBS, irritable bowel syndrome and much more, here we are at Omar Specialist Clinic to discuss the same. Welcome to yet another episode of Health is Wealth, and today we are present at Umar Specialist Clinic. And what are we discussing today? We're discussing what each one of us is suffering from lately. Why? Because our eating habits are extremely bad and so is our hygiene, and we don't know what to do. We have IBS, we have, colon cancer, and I'm taking the more complicated names first because almost everybody speaks about stomachache, heartburn and all of that, and hepatitis, which is really discussed but not treated as nicely or as properly as it should be. So we have with us gastroenterologist and hepatologist Dr. Umar. Congratulations. It's a beautiful setup out here that you have, and you're treating so many people with this stomachache that just doesn't go away. We are all suffering from it. Let us talk first about IBS because that is something that is, least spoken about and most common lately. So what are the symptoms of IBS?
IBS is actually a very broad term, It is an amalgam of a lot of symptoms, and it is also sometimes, misdiagnosed in our country. Everybody goes to a GP or a simple doctor or sometimes even quacks, which are very common in our country, and they just label you as IBS. And you'll see a patient after 20 years and he will clearly say that I'm suffering from IBS since long. But once you go deep into the disease, it turns out to be a different disease. So we have to be very clear about IBS. IBS is hyperactivity of the colon. Okay. It's a stomach flu, for instance. The patient of IBS might be suffering from dyspepsia, vomiting, nausea, altered bowel habits. That is one of the most important signs. That is, your bowel is not healthy.
So sometimes you get diarrhea, sometimes you get constipated, bloated all the time.
And sometimes you might even feel pain. There are three types of IBS commonly: diarrhea predominant, constipation predominant, and mixed type, which includes pain. And diarrhea predominant and mixed type, that is pain induced, should be worked up properly so that we don't miss anything other than IBS. There are a few diseases actually which we need to see before labeling a person as IBS. For example, IBD, inflammatory bowel disease. The difference will be that the patient might have bleeding in his stool.
And weight loss and feeling a lot of
joint pains, lethargic, skin rashes. Then there is a very common disease which is not that much, diagnosed in our country, celiac disease.
Oh yes, a lot of people have that. Yes. They're so thin their whole life and they keep saying, we don't gain weight, what should we do? And they still keep eating wheat.
And they've been labeled as IBS. Yeah. And there's a simple blood test which will, confirm that whether you are suffering from gluten or not. The other diseases which go simultaneously with IBS, like giardiasis, tropical sprue, SIBO, that can be, confirmed with the history of the patient.
Okay, so when somebody is actually suffering from this, they have this, weird taste in their mouth, they have some sort of heartburn, they have bloating. You're saying that they need to go and get a set of investigations to rule out whether they're suffering from Crohn's or ulcerative colitis or anything else, or they're suffering from irritable bowel syndrome. Could you please list down all the standard investigations? Because you're also an intervention gastroenterologist, I know that. So could you please list down all the investigations that a person needs to do before labeling himself?
First of all, before going for self-diagnosis or, for any lab investigations, it's better that you visit a gastroenterologist because, he will ask questions in a chronological order from head to toe, and they will confirm what symptom you're having and what test we should go. Because, otherwise the test might go up to 1 million as well. Yeah. So it's better to have those question answers and then go. But in general terms, for example, if you want to label a person as IBS, the most common and the best test is stool routine examination. Okay. It's a very cheap test as well. It's not that much expensive because that will tell us about the consistency of the stool, presence of an ova, cyst, parasite or mucus or blood. Okay. Then a simple blood test like blood CP, it will tell us about the lymphocyte predominant, neutrophils, HB of the patient.
If there is blood in the stool.
Yes. Then these are the very common two tests. Then when you go to the specialized test, in female, I always recommend thyroid profile. Okay. That is very important because, a lot of females in our country suffer from thyroid, but they've been labeled as IBS. That is what I've seen in my practice as well. Right. Because, when there is hypothyroid or hyperthyroid,
you get constipated or diarrhea.
It will affect the gut.
Yes.
So for females especially, the thyroid profile should be done. Then we come to the specialized test according to the family history, according to the patients. There is a fecal calprotectin test,
Okay.
which will tell us about the inflammation of the gut.
Okay.
There is an anti-TTG, IgG, which will tell us about the celiac disease. Then the general profile, like liver function test, RFTs, and hepatitis B, C. They should be done commonly.
Okay.
For instance, all these tests come down negative, and you've been on certain medicine, you're trying to improve your lifestyle more.
Right.
Then we go towards the interventional part of that. Either do an endoscopy or a colonoscopy according to the
So
patient.
not everybody is a candidate for endoscopy
No.
or okay, that is very good to know, because often hepatologists and gastroenterologists are accused of this, that they almost make everybody lie down.
I beg to differ with that. I beg to differ with that. Times have changed,
Right.
and now a lot of my colleagues, we do not, unnecessarily, we do not perform endoscopy and colonoscopy. According to guidelines, if you go, there's just a certain thing, there's a miscommunication between the patient and doctors. Actually, if your GI doctor communicates in a good way with the patient, and if she or needs, then we should do. But there are certain red signs which every patient should know, that those red signs and clono should be done. For example, there's a weight loss,
Okay.
cachexia, emaciation, that is, patient has started losing his
Losing a
muscle.
lot of weight.
There's
Okay.
decreased HB.
Okay.
There is bleeding in the stool. There is any lump or bump in his stomach. Or, God forbid, there's a history of GI cancer, that is a stomach cancer or colon
Okay.
cancer in the family.
Right.
These are red signs, and these are the patients whose colonoscopy and endoscopy should be done immediately.
Okay.
From other population, if a person is having stomach medicine and he has improved his lifestyle for a period of 3 months and still he or she does not improve, then we go towards the endoscopy and colonoscopy.
So we know that inflammatory bowel disease is treated very differently with proper medication and a full, treatment guideline. What about IBS? They say it has a lot of psychological connection. It has a lot of stress. It's stress induced, and we need to relax ourselves and all of that. And the gut is directly related to our personality, our thinking, our dreams, and all of that. So how do we fix this IBS?
So now IBS is, there's a gut and a brain axis.
Right.
There are many things which lead to IBS. Either it is stress, either it is travel, either it is change of, dietary habits, sometimes even post-COVID, or a post-disease or a complicated disease, the patient might develop IBS. IBS is treated basically, first of all, with dietary habits. Then we treat IBS supportively, that whether a patient is suffering from diarrhea, we give antidiarrheals.
Okay.
If he or she is suffering from constipation, we give laxatives. If there is pain, we give smooth muscle relaxants. If there is dyspepsia, nausea, other GI symptoms, so we give PPIs and prokinetics accordingly. So the treatment is primarily supportive.
Okay.
The curative treatment depends actually on the will of the patient.
So it's a psychotherapy and CBT
Yes.
and all of that.
First we have to, conclude that what has led to IBS, whether it is stress, an underlying disease, an underlying family history, travel, and all these stuff. And then we come up with a plan how to treat it.
All right. So a lot of patients out there have heartburn. They keep saying our heart, our heart is burning in these terms, and they have GERD, which is gastroesophageal reflux disease,
Yes.
where whatever they eat starts coming upwards. So what is this about, and how do we treat it?
Heartburn, GERD, gastroesophageal reflux, functional dyspepsia. This is also a very broad term. It is, in common words, just the inflammation of the esophagus.
Okay.
Your stomach acid comes back into the esophagus and you feel a sense of burning sensation. Sometimes you feel heaviness and sometimes you feel regurgitation.
Okay.
Especially at night time, a lot of people complain that there is fluid coming out of their mouth. The most important and first thing for that is, if a patient is obese,
Right.
he or she should lose weight.
Okay.
There must be a gap of 2 hours in the last meal and before lying on the bed, because the thing is, we eat and we lie down.
Yeah,
So-
and that too we are lying
Yes.
flat. We
Yes.
don't
So
lie.
that is
reclining.
when the
Yeah.
problem starts.
Okay.
If with certain lifestyle modifications things do not improve, then there are certain medications, PPI, antacids, and prokinetics for this. But the most common cause of GERD or functional dyspepsia is our eating habits. And in long term, this is not good. We take it very lightly. Oh, Dr. Sahab, I have a heartburn, I'm taking PPI for the longest. But in long term, this will have a lot of implications on your health. The esophagus goes into the stomach and there is a lower esophageal sphincter,
Right.
which controls the acid
Yeah.
coming out into the esophagus.
Yeah.
With continuous irritation, it will start getting lax. Once it gets lax, it will develop into Barrett's esophagitis and, God forbid, carcinoma in long term.
Okay. And we tend to take it like pills, all these antacids, and especially our PPIs, the proton pump inhibitors.
They're
Everybody,
sweets of our country.
everybody keeps popping them on their own, on through the web or through just friends telling. So, are there any side effects or negative adverse effects? Because it's a medicine after all; it's not candy that we can keep taking it. So, could you please guide them on that as well?
So the most common side effect of PPI, especially in a female of a childbearing age, is osteoporosis.
Oh,
Yes,
I never knew that.
Oh no, it's very, very common. It affects the bone.
Okay.
And the thing we need to understand is PPI irreversibly binds with the proton pump inhibitor. So that will obviously lead to a lot of implications. There are better salts as well. Vonoprazan, it's a new salt, it's a PCAB. It reversibly binds with the channels. For female, the common is osteoporosis.
Right.
The other is if certain guys are taking PPI for the long term, it can develop into lentus platicus.
What
That
is
is, your stomach becomes lax and there's a white bearing on the channels because of chronic suppression of the acidity. So it can develop later on into a lot of different diseases as well.
So antacids as well are very bad. They shouldn't be
Antacids
used a
sometimes-
lot as well.
Antacids sometimes cause constipation. And, there are aluminum-based antacids, there are magnesium-based.
They could be stones
antacids,
as well.
Yes,
Yeah.
they can cause a lot of side effects. But from PPI, in my opinion, antacids are better.
Oh, so they're far better than
If you
taking
want
a
to take
PPI.
it on SOS basis. This is what we are talking about, SOS basis.
What about carminative, that white liquid that used to come in the past with Materia Medica? Is it of any good?
These all medicines sometimes, have a very psychological effect.
Okay,
There are a lot
so
of
like a
patients
placebo
who...
effect?
Yes. There are a lot of people who will come and say, okay, green tea is effective to me.
Yeah.
Peppermint oil is effective to me. Yes, there are studies on charcoal and peppermint as well. that
Yeah,
they're effective.
they say simethicone, charcoal,
Yes.
and all of that is
They're
good for
also
gas.
effective.
Yeah.
But in my opinion, all these medicines should not be taken without a prescription.
Okay.
In foreign countries, PPI is not an on-counter drug.
Right.
You have to get a prescription
Yes.
for it. Antacids are just an on-counter drug.
Yeah.
But in our country, all of these medicines are being abused.
Everywhere.
You come across a patient and he or she is taking PPI for
ages. Yeah.
Casually they'll say, Doctor, I'm taking it for 5 years.
Yeah, I know.
So that is not
okay.
good.
And then we hear a lot about H. pylori. Some of our
Oh.
doctors love talking about H. pylori all the time. So what exactly is this H. pylori? Why is it so prevalent? Does it ever go outside our body? And what is this term, peptic ulcer? What does it exactly mean?
Peptic ulcer is again a very commonly and misinterpreted, disease which has been labeled in our country. Peptic ulcer can be because of a lot of diseases.
Okay.
But in our country, mostly it is related with H. pylori because this is which we are hearing for the longest.
Right.
H. pylori is a bacteria. It comes from contaminated water.
Okay.
And unfortunately, in our country, you cannot get away from it. You go to public toilets, you wash your hands, you
hygiene
drink
habits
water.
are horrible. Yeah.
So that is why American college has changed the guidelines.
Okay, what are they
That
saying?
if, as a third world country, unfortunately we're a third world country, if somebody suffers from H. pylori and he or she has taken a proper course of 14 days
triple
of medicine,
regimen?
then there is no need to repeat the test for next 2 years.
Okay.
Because you might be positive again after 6 months,
Right.
again after 6 months, again after 6 months. So for how many times you will take the antibiotics? So they have changed the term for it. The most common thing to do for H. pylori is hygiene. Improve your hygiene.
Yeah.
Boiled water. Keep a sanitizer with you. If you have to wash your hands in a public place, keep a sanitizer with you. Do not, have the tests done because there are a lot of patients we see who have taken the
Addicted to
antibiotics.
it, yeah.
Yes, they've taken the antibiotics for the H. pylori test. They again come back after a month or so, I'm still positive. First of all, you need to understand there are certain different tests as well. There's a stool test, there's a UBT test, there's an endoscopy, there's an antibody, there's an antigen. Most of them has antibody positive and there's a doctor, I'm still positive. But yes, unfortunately, it is very, very common in our country. And the steps should be taken at all
So this
levels.
15-day antibiotic course that is given, usually the 3 or 4 antibiotics, could you please talk about the compliance of completing this course to get rid of it? Because what people do is they get resistant. Antibiotic resistance is resistant as well because they just keep leaving it in the middle
Yes.
as soon as they are relieved of symptoms.
Because unfortunately what they say is, Doctor, these 2 antibiotics are very heavy for us.
Yeah.
And I'm not being able to tolerate it. So on the 4th and 5th day, they leave the antibiotics because, unfortunately in our country, we go on the grams. Oh, doctor, this medicine is of 1 gram, this will not be heavy on our stomach.
Right.
And I tell them that poison also comes in 1 milligram.
Yeah.
So this is just a medicine, take it in 1 gram.
Exactly.
But still, yes, I get it. 2 antibiotic courses might be, heavy on your stomach, but once you're positive, you have to take the
Exactly.
right course, and you should not take antibiotics at your own will. You know,
Yeah.
you should take the
They should
prescribed
complete it.
dose and everything.
What about taking NSAIDs on an empty stomach? Because a lot of people have ulcers, and they're very fond of popping pills. Especially they'll be taking ibuprofen and aspirin just on an empty stomach, and the effect that it has on your gut.
You know, NSAIDs, painkillers, even the ischemic heart disease patients,
Yeah.
Loprin, Escard, which they
Yeah.
have to take. Unfortunately, they do not take it at the right time. The
Right.
medicine should be taken at the right time. NSAIDs have a very obviously long-term effect on your stomach and at the kidneys at the same time.
Right,
You know,
they
we
do.
only talk about the ulcer part of it, but they affect the kidneys as well. So we should not take it, quite often, and especially not empty stomach. We should try to take it at the time when we have eaten something, and in the morning. But unfortunately, a lot of people say, Doctor, sir, we suffer from it at the night time. So how can we take it in the morning?
Right.
So the best part is get a healthy lifestyle.
Yeah.
Get away from these pains.
So when we talk about a healthy lifestyle, we know that exercise is very important for the gut. When you speak of a diet, an ideal diet for the gut, could you mention what are the things, what fiber content, how we should include more and more fluids and fiber to, have a healthy bowel movement, and the role of probiotics as well?
I'm a big fan of probiotics, by the way. The simple formula is breakfast like a king, lunch like a rich man, dinner like a poor man. And unfortunately, we go the other way
Yeah,
around.
exactly opposite.
The breakfast should have a high content of fiber.
Right.
Oatmeal, cereals, porridge, they will do the trick. A boiled egg, a brown bread. In lunch, I always recommend to have a portion of either chicken, fish, mutton, whatever a person likes. And in the night time, you can have a half chapati, a home-cooked curry, vegetables, whatever. And in between, you can have a fruits.
Right.
Obviously, this is not possible not to cheat.
Yeah.
Cheat once in a month,
Yeah.
not every day.
But stressing on not getting a lot of refined products in our diet, not a lot of processed meats, in fact, going for the more organic kind of diet.
See, the thing is, unfortunately, we do not have that much of a good chicken in our country. Everybody knows that.
Yeah.
You know, the most common cause of hormonal
Imbalance,
in
PCOS,
females
PCOD is chicken. Yeah.
steroids in the chicken.
Yes.
So obviously try to get things from a good vendor.
Okay.
And then, try to eat healthy. That is the best possible, somebody can do. Going towards the organic, going towards, an expensive food. I don't recommend that. Just try to eat healthy.
I think organic is the one you grow in your own garden. It's the most organic food.
But-
it's not expensive.
Yes,
You can grow it.
but
Yeah.
we talk about the middle class, lower middle class as
Exactly,
well.
yeah.
So they cannot do that.
Right.
But all at least they can do that is, they can eat healthy.
Right.
They can walk, they can meditate and all that
So
stuff.
when we talk about food intolerances, we spoke about celiac disease. Could you stress, a little more on what is, a gluten-free diet? What are the things that don't contain gluten? Why is gluten, why are you allergic to gluten? That is why you're not, digesting your food. And also then on lactose intolerance and some other food allergies as well.
See, the thing
Yeah.
here with gluten is, that is a very, very important thing which we need to understand. If a child is not being able to achieve his or her milestones, that is, there is a growth problem, there is a neurological deficit, there is diarrhea, there are GI symptoms, you need to have him tested for the gluten allergy. Because once you remove the allergen, the
Then they
GI
can
tract
grow.
becomes better,
Yeah.
and he or she starts developing his
Yeah.
her milestones. It's very, very common in the West, but it's common in our country as well.
As well.
The other allergies which we mostly see, peanut allergies, nuts allergies, we don't come across those allergies quite common in our country. But there are few allergy tests for them as well. NIH is doing a very good work. They have got all these allergy tests. Lactose intolerance, lactose intolerance is actually more or less a symptomatic diagnosis.
Okay.
A patient comes and he or she says that after milk, after dairy products, I feel, bloated, I feel pain, I feel diarrhea. So that is more or less a symptomatic diagnosis rather than, we have to do an intervention for that. For example, I see a lot of patients who say, Dr. Sahab, we don't feel comfortable after pulses. Okay, fine, don't take it.
What is that FODMAP diet and all of that? Not to have cruciferous vegetables. What is that about?
Low FODMAP diet is mostly given to IBS patients, the ones who feel bloated and all that. It includes a certain part of vegetables, lettuce, cabbage, and green leafy vegetables.
You shouldn't be taking them, or you should
The
be?
ones who feel bloated should not take
should
them.
not take them. All right. Okay. Now let's come to the liver. Our
Yes.
liver is, severely compromised. One, almost everybody has hepatitis C, which they don't know about. And secondly, they have fatty liver. So let's talk about both this non-steatotic fatty
Hepatitis.
liver and as well as hepatitis C. Let's start with hepatitis first, most common.
Hepatitis is unfortunately very common in our country, but alhamdulillah now it is getting a bit better
Okay.
because of the medicines. The medicines are very effective and they don't have that many side effects. But the thing most important, why we miss hepatitis is because the screening is not done frequently. So I think every person should do a hepatitis B and C screening after every three years at least. The ones who are high risk, like healthcare workers, barbers, and all those people, the ones in the, sorry, सफाई वाले कहना था मैंने. अच्छा, the high risk population,
Right.
they should get these tests done every 6 months or 1 yearly. God forbid, once you're diagnosed with hepatitis, do not panic, because now the medicines have least side effects.
Yeah.
But unfortunately, people do not go
Take
to the
those-
doctor.
yeah, they don't take that course.
Yes, they wait, they say we might develop a lot of side effects and all, and that is why they later on develop cirrhosis.
Yeah.
Cirrhosis is, the liver size decreases, shrunken liver. And there are a lot of signs of that. For example, you might have jaundice, yellow eyes, you might become emaciated, you start losing weight, males might develop gynecomastia, that is breast. There are petechias on body, skin rashes, ascites, fluid in the
And
fluid
that's
in the abdomen.
irreversible, then
Yes.
you need replacement.
And then,
Yeah.
upper GI bleed, that is hematemesis, vomiting in the blood. Once cirrhosis develops, there are supportive treatments and yes, there are curative treatment, but that will be, a very long topic. So these are just a few signs of cirrhosis. Simple fatty liver.
Right.
That is what we need to understand, and that I think should be the basic topic.
Okay.
Once, God forbid, you have fatty liver, the 3 tests must be done.
Okay.
Hepatitis B, C,
Okay.
diabetes and cholesterol. Because
Okay.
once they're negative, then we put on non-alcoholic steatohepatitis or NAFLD. Yes, there are other diseases like Wilson disease, hereditary hemochromatosis, autoimmune, but obviously the doctor asks this question and then there's no need for the test for them. But once you have NAFLD, that is non-alcoholic fatty liver disease,
Right.
it primarily depends now on you that how you improve it.
Okay.
Because it is mostly because of our lifestyle,
Right.
our foods and our habits.
Okay.
And the guidelines also suggest that for the first 6 months, there shouldn't be a medicine taken for it.
Okay.
You should only improve your lifestyle.
All right.
After 6 months of lifestyle improvement, if there is no improvement, then you can go towards certain medicines. The foods which are good for fatty liver are the ones which have antioxidants.
Okay.
Cranberries, blueberries, blackberries. Unfortunately, they're not that much available in our
Yeah.
country. And the maximum studies are on pure black coffee.
Okay. That's good for the liver?
Yes, if you are a coffee fan
Okay.
and you don't have any GI symptoms,
Okay.
then you'll get rid of fatty liver with pure
Really?
black coffee, yes.
What about this milk thistle and silverin? How good are
Silymarin.
these? Silymarin or yes. How good are these?
There are a lot of studies on them as well.
Right.
Silymarin, a lot of studies are on silymarin and a lot of studies on milk thistle as well. But they also come, in a supportive treatment.
Okay.
And they have indirect effects, and there are certain things which have direct effects, like L-ornithine, L-aspartate,
Yeah.
that comes in a syrup form, a sachet form.
So
that
it's
has
good for you?
Yes, once your LFT is deranged. If you have simple fatty liver
Yeah.
and your ALT is normal, then I don't recommend taking any medicine, just improve your lifestyle. But if your liver function tests are not, they're deranged, then we go towards certain
Okay,
medicines.
let us mention a little bit about Hakim's kushtas, because a lot of people keep taking these things for different reasons: vitality, liver health, their stamina, and then they end up with a lot of toxicity of heavy metals in the liver. So could you stress on that part so people know that they're not supposed to take just anything marketed now online as well?
There is a Chinese herbal tea also, very common these days, and I've seen a lot of patients come with, deranged
For weight
LFTs.
loss, they take it for
weight loss and fatty liver,
Okay.
and then they develop drug-induced liver injury. That is, your transaminases go haywire. I just came across a patient 2 weeks back, and unfortunately, he did not survive, and he just took 3 or 4 days of medicine for that.
Really?
Yes.
So just by taking that herbal tea?
Yes. We can not 100% be sure that it was because of herbal tea, but his all other tests were negative.
Okay, Dr. Sab, I have a personal question being a dermatologist. There are a lot of people nowadays on whitening injections and on drips, and we really don't know what lies inside them because they are just products from China and Korea and here and even local. But people are going crazy for these whitening drips, and they have a lot of things at once with a lot of glutathione. I don't know how much of glutathione is actually in there. But how harmful can these IV injections or drips every week be for a person?
See,
or their effect on a liver?
When you talk about Korean or Chinese medicine, obviously they're good. But the only problem in our country is that they're not coming from the right channel.
Yeah.
You know, China is a very close friend of ours. So, but the problem is they're not coming from the right channel.
Right.
And I don't even get it that whether they are really from Korea or China.
Okay.
That is the first thing which we need to confirm. You know, they might be made somewhere, you know, in our neighbors as well.
Exactly.
So
Could
that
be
is what the
anything.
problem
Yeah.
is. Here, DRAP needs to do the work, and they're doing a good work as well. You know, the channel should be maintained and their forms should be checked.
But it's okay to take them? What are you,
know,
advising for the liver?
You're a dermatologist.
I don't advise them to my
Yes.
patients. Yes.
But, you know, any medicine in an overdose is obviously not good.
Exactly.
And glutathione, yes, if you want to take a single shot of it, it has no effects on liver. But any medicine which you start taking regularly, you know, they might affect your
What
liver.
about multivitamins? Because a lot of our vitamins are not excreted via the urine. So like vitamin A, D, E, K. So can we have like an overdose by taking a lot of vitamins?
I've seen a lot of patient with vitamin toxicity, especially vitamin D and B12. Because there is a hokum in our country that, you know, every few days I need a methicobal injection.
Exactly.
And vitamin D, there are a lot of people who are taking pop-up medicine for vitamin D for the
and
longest.
It comes in jellies
yes,
and
vitamin D toxicity obviously creates a lot of problems on your kidneys. Vitamin A might cause, you know, blindness, and there are a lot of side effects of all these medicines. I'm not in a favor of multivitamins for no reason.
Okay.
You know, you keep your stomach healthy, eat healthy, all the nutrients are there in all the vegetables and fruits. So there's no need for the multivitamins until and unless, God forbid, you have a disease.
Right.
You know, you're suffering from a disease, only then take the multivitamins. Do not take the multivitamins without an advice of a doctor, and do not abuse them for the longest. You know, you've taken a tab, you take a pack, it's finished, just get it off.
Yeah, so you
know,
give a gap.
Don't repeat it, don't
Right.
keep on taking it for no
Let's
reason.
talk about colon cancer now, because it's very, very rampant, and we don't, you know, get to hear a lot about its awareness. Even though a lot of men in our country, especially after the age of 55, do suffer from colon
Yes.
cancer and do lose their life because of it, and they don't even realize that if it's detected early, their life can be saved. Can you, you know, shed light on that?
See, the thing is, once you're diagnosed with a cancer, any cancer, there are guidelines for it. For instance, if there is a colon cancer in your family,
Yeah.
all the first degree relatives should have a screening colonoscopy.
Okay.
But we do not do it. You know, that is where the things come into the light. We need to educate the people. For example, if there's a breast cancer as well, you know, there are guidelines. If a certain first degree relative is having a cancer, there are guidelines for it. We're talking about colon cancer. If a first degree relative has suffered from colon cancer, every first degree relative should have a screening colonoscopy or a sigmoidoscopy.
Okay.
If there are 2 or 3 relatives suffering from the same disease, the guidelines change, the frequency change, you know. We begin screening at the age of 18 as well. And even there are certain diseases like Peutz Jeghers and all that, in which we have to do a sigmoidoscopy in a child of 8 years.
Right.
So there are guidelines for it. Now, God forbid, what are the signs of colon cancer?
Right.
PR bleed, that is bleeding in the stool, change of consistency in the stool, weight loss,
Right.
sometimes lower abdominal pain, you feel a lump or bump in your left or right side of the stomach.
Right.
ठीक है. These are the few common signs of colon cancer. But the most important which we need to do is, if there is an alteration in your bowel habit, and now the most important thing is, because now the people will say, IBS is also having altered bowel
Yeah.
habits. But there are things and there are alarm signs, there are
Investigations
right
as well.
signs. For example, an IBS patient will not get up in the night. There won't be any nocturnal episodes. You know,
Right.
you're asleep, you will not get
They won't
up.
have any rectal pain,
Yes.
bleeding, weight loss.
So that is the most important, because I unfortunately see a lot of young people and they say, Dr. Saab, I'm suffering from colon cancer.
because
So-
they're doing Google Doctors,
Yes,
right?
so that is the thing which we need to understand. But most important is, if there is a relative in your family who unfortunately has colon cancer, you need to visit your GI doctor and have your screening colonoscopy or a sigmoidoscopy
And what is the
for that matter.
prognosis? A resection, and does it help?
Yes, that actually depends, on the severity, the grading of the colon cancer. If it is detected early, there are very good results of colon cancer. There's a very good chance of recovery. Now, the good thing is we have a very good team of doctors as well. We have colorectal cancer surgeons. We have a good team of oncologists in our country. We have good GI doctors. We have good histopathology options as well. So this is an MDT, multidisciplinary team approach. But the earlier is always the better.
It's always better. And what about stomach cancer? How common is that? Is that common in our country? Do people get stomach cancer?
Stomach
and how does that
cancer,
present?
stomach cancer is common in Gilgit-Baltistan. Unfortunately,
Why?
it's very, very common.
Is there something to do with their
Genetics,
smoky diet?
No,
They
genetics,
smoke the
smoky
food.
diet, and in my opinion, there haven't been any studies, but they take salted tea.
Oh, actually they take a lot of salt in everything
Yes.
because of preservation.
Yes.
They want to preserve the food, obviously, so they put a lot of salt in
Yes, so because, in the world, stomach cancer is most common in Japan.
in Japan because of salt issue.
Yes, and barbecue and that thing.
And
but
spices, a lot of spices.
Yes.
Even though Gilgit-Tis don't use a lot
in
of
our
spices.
country,
Yeah.
Gilgit, if you go to Gilgit, there is, in every family there's a guy suffering from stomach cancer, unfortunately. And we see a lot of patients as well. In my life, I must have come across 100 patients of CA stomach, or more or less.
And all from Gilgit? Mostly.
90% unfortunately from
that is
Gilgit-Baltistan.
that really requires attention there.
We've got friends in Gilgit. There's a very good friend of mine, Dr. Shahid Alam. He's working a very good work there.
I know him pretty well.
And so, these people are doing very good work. They're trying to educate people there as well regarding the CA stomach.
Right.
So let's hope in future, inshallah.
That it
You know,
helps. Yes,
yes,
hopefully. So what would you guide to all our viewers out there that if they need to take care of their gut properly, what is the proper thing, proper guidelines that they should follow that they have good gut health, like in terms of
the tagline
their
which I
lifestyle?
mostly
And
use
you
is,
can speak about smoking as well.
yes,
Yeah.
the tagline mostly which I use is, if you got a good gut, you're healthy and you're good to go, my friend. So everything begins from a good gut. The best thing is, have a good carbs, have good proteins, have good fats, have good hydration, have a healthy lifestyle, exercise, walk. Once your gut and your muscles and everything is fine, health is wealth.
Right.
We never realized it when
That
we
is
were
the name
child.
of our program
Yes.
as well.
When we were children, we never realized it.
Yes.
Now, when we are getting into middle age, although I'm young, I don't say that I'm in middle ages, but now I've realized it, that health is wealth.
Right.
And that is the most important thing, especially in our field, in doctory. We come across and we see a lot of misery, and then we realize the importance of health.
Exactly.
And the most important thing for health is good food, good exercise, good hydration.
And a good attitude as well,
yes,
right?
good.
To
yes,
stay calm and happy
stress-free,
and positive.
yes. So that is the most important thing.
But that is the most important thing. When we come to interventions, could you, at least guide the patients about what exactly happens in an endoscopy? How do you prepare them for it? Because a lot of people, even when they're advised endoscopy, they have all the red flags, but they're very scared of the procedure. They think, their intestine is going to perforate right in the middle, they'll die on the table, and it's a big operation or something like that. Could you please guide them? How long does it take? What does it take to do before it? And if there could be any complications, or how do you weigh the benefits over risk?
Over the period of time, the machines have changed, the techniques have changed. Endoscopy and colonoscopy, they have very, very, very less side effects now, alhamdulillah. Because the machinery is very good, the techniques of the doctors are very good. Our teachers have been kind enough that they taught us good. Endoscopy rarely has any side effects. But the most common thing which people are afraid of, that when you put a camera inside,
Yeah.
while pulling it out, you might
might
develop
puncture,
ulcers and all these things, but that does not happen. It's a fibro, it's a very protective pipe. It's a very soft pipe. It do not create any problem for you. Plus, once we're in the lumen, we put a scope inside. We inject air so
Right.
that the lumen swells,
Yeah.
and we do not touch anything, for instance. So it never touches the mucosa. And even if it touches, it does not develop any, side effects and all. Endoscopy hardly takes 2 minutes or 3 minutes depending on your doctor, if it's a diagnostic. That is if you're only doing for diagnosis. But if there's a therapeutic, that either you have to put a stent, you have to band ligate, you have to take a biopsy, you have to put a tube inside, then it may vary, the timing may vary according to the therapeutic. Similarly about the colonoscopy, if you're just going for a diagnostic colonoscopy, it might take 15 or 20 minutes max, depending on, the doctor, and depending on your weight and everything, because, there are a lot of angles in it.
Yeah.
So weight creates a bit of problems, and especially in females, the ones who had a history of a C-section and all, because of adhesions and all, it might take 5-10 minutes extra. But the side effects are very, very rare for a diagnostic procedure. For a therapeutic procedure, that might vary according to what the procedure is needed for. Then there are certain specialized procedures in gastro as well, like ERCP and endoscopic ultrasound. You know, they're highly qualified procedures, and you know, a highly qualified doctors does those. Those procedures have certain side effects, but luckily, alhamdulillah, not that much now. The side effects have reduced because of the techniques and everything.
Okay.
So endoscopy,
It's nothing to fear.
Oh, nothing to fear.
All
Nothing
right.
to fear.
So you're in safe hands,
Yes,
right? So we
inshallah.
can think we're in safe hands when we come here. What about babies? Why are they so colicky? They say baby colic, and they're crying and howling, and some of them have constipation, and some of them are even diagnosed with things very fancy like Hirschsprungs, for instance. So what can you tell about colic, and how do you guide everybody about
The most important thing in a child, you know, it's a misnomer in my opinion. Whenever a child is crying, the mother says that he or she is suffering from a colic. And now, as far as diarrhea and constipation is concerned, you know, the child is in a diaper.
Right.
You cannot be sure about that whether he or she is suffering from diarrhea or constipation. The best and most important thing for that is to do a stool RE.
Okay.
There's a chart which I commonly use, Bristol classification chart. There are types of stool which actually tells us about that whether he or she is suffering from constipation or not.
Okay.
Because obviously an infant or a child won't be able to tell that whether I have passed the poop or not. So that is primarily for the mother.
Right.
The most important thing for the mother is not to worry, not to panic.
Okay.
I get it, it's your child, you panic, but not to panic in first place. But if there is, you know, blotting, if you feel the tenderness in the stomach, distended, if there is a change of the consistency of the stool, then you need to go to your GI doctor or your pediatric specialist as well. Then they will come up. Hirschsprung disease is obviously a very, very broad term. There's a lot of other different diseases associated with it as well, and there are different signs for it as well. But obviously that will be after the examination from your pediatrician, and then after certain x-rays and ultrasound, and then we'll come up with a diagnosis of Hirschsprung, God forbid, and it has altogether a different treatment options.
Now, the most common complaint, gastroenteritis or diarrhea, that almost everybody has every other day, food poisoning, thanks to our very, very, very unhealthy and unhygienic habits that we have of eating. But once we get the diarrhea, we have this tendency that instead of, you know, fixing the hydration level or rehydrating the patient, we tell them to stop eating everything and drinking everything because they have diarrhea. And we like to stop the diarrhea immediately. So how should we deal with diarrhea?
See, the most important thing with diarrhea is do not take flagyl, do not take antibiotic right on the first day.
And do not take Imodium as well.
Yes, at least on the very first day. The problem is once we have diarrhea, you know, we start taking the on-counter medicines. First, we need to understand what diarrhea actually is. You know, people come to me, Dr. Sahab, I'm suffering from diarrhea. When you ask the question, they just had one episode of a soft stool. So that is not diarrhea. And every diarrhea should not be considered, you know, bacterial. They're viral as well. I do not recommend taking medicines on the first 2 days at least. The first 2 days should be, you know, electrolyte imbalance should be treated, hydration and all these things. Yes, there is no need to stop every food as well, but at the same time, do not eat unhealthy. You know, you can have home cooked food in a good environment.
Rice, yogurt, banana.
Yes, all these things you can have it. But importantly, do not take antibiotics for no reason.
And
antidiarrheals.
And about ORS, how do you make the ideal ORS, and how important is rehydration in somebody losing a lot of fluid if they do have like full-blown diarrhea, a lot of episodes of you know, watery stools along with vomiting?
In diarrhea or in anything, the most important thing is electrolyte imbalance, and you need to treat your electrolyte imbalance. The thing which people mostly do is they only take fluids. They start you know, having plain water. You're a doctor yourself, you know that. Once you start taking water more than 2 to 3 liters, you know, there will be hyponatremia. The sodium will also become less. You'll have cramps and body aches. So what I suggest to my patients is once you start taking more water than 1.5 liters, you know, you need to replace the electrolytes. A simple half lemon, you know, black pepper and a simple tinge of salt and tinge of sugar can, you know, will do wonders for you. And then we have ORS in different forms as well available on counter, you know, but you really need to replace your electrolytes.
And what is the role of zinc in this?
Yes, zinc is actually an antidiarrheal. In children, it is mostly used in children, in adults as well. Zinc has a very, very good role, but you know, you should take it in a controlled amount. You know, the dose which your pediatrician or a gastroenterologist have recommended, only that, you know. Don't take it yourself, and you know, don't take it 3 or 4 times in a day.
Okay. What about worms in children? A lot of children come with stomach ache because they have their weight is not, they're not gaining weight because of worm infestation.
Yes.
How common is that, and what do you have to say about deworming?
Unfortunately, very common because of bad hygienes. Most of pediatricians do deworm the patients without any test,
Right.
but I never recommend that. I always say it's a simple stool test will tell us about that which worm they have, and then go towards specialized medicine targeted to that worms. But yes, once you see any patient at the age of 13 and 14 and you ask their parents that how many times you've dewormed it, Doctor Sahab, many times. That is unfortunately not good.
Okay, you
Because-
shouldn't be over deworming them as well.
Obviously, for no reason, you need to have the evidence why you're treating it.
Yeah.
And yes, worms have a lot of side effects. There is iron deficiency, anemia can be there. There can be multivitamin deficiencies there. Sometimes even you might come up with subacute obstruction or obstruction as well,
Right.
if the worms are in a high amount. The most important thing is hygiene in children. Nail hygiene. You have to educate them about all these hygienes, because once your hygiene is fine, there won't be any need of deworming.
So, what are the different congenital conditions that babies can be born with, where there is malabsorption, or if they're growing up, that whatever they're eating is not being absorbed? What are the different reasons of malabsorption? So we know that why we have a nutrient deficiency, why we are lagging behind, and all of that.
The most common celiac, which we already studied. Other than that, there are Gaucher disease, there are glycogen storage diseases, and all these diseases. But that baby or a child will obviously be having a lot of signs
Okay.
in his childhood, which your doctor or pediatrician needs to find. And that is why we always say that do visit a pediatrician every 3 to 6 months.
Okay.
So that if there are any signs which you are missing, that pediatrician will examine you from head to toe. Because if there are certain multivitamin deficiencies, there might be spots on your nail, there might be skin changes, there might be lax joints,
Right.
there might be
Yeah.
jaundice, there might be brittle hairs and all these stuff. And the common population might miss those signs. So that is why you need to visit your pediatrician, so that he or she examines the child. Because once you have malabsorption, it does not mean that you do all the tests
Yeah.
of malabsorption. You need to confine that which part has created malabsorption, whether it's the small gut, whether it's the large gut, whether it's the stomach, whether it's the liver, whether it's the pancreas, and then do the test accordingly, so that it saves money and time as well.
Okay, so a lot of people nowadays are using Ozempic and other similar drugs to lose weight, and it's causing a lot of gastroparesis, or they're saying it's causing gastric ileus, and it's making the motility really go bad, and it's causing pancreatitis. Nobody speaks about it because the pharmaceuticals control the media predominantly. So what would you suggest? Should people go for drugs like Ozempic, and does it really do cause
Unfortunately, in our country, we have to follow the guidelines of the American college or the European college, because in our country, the publication is not up to the mark. And
Right.
the reason for that is because the patients are not followed up accordingly. You lose the patient at follow-up. That is the biggest reason. That is, we have good doctors, we've got good data system, we've got everything. But the thing which we need to improve is follow-up. Because once we have the follow-up, we will be able to develop our own guidelines. The thing with Ozempic or any certain drugs which are now for weight loss, that those studies have been done in foreign population on their genetics, on their food, and we unfortunately have to follow them.
Right.
Yes, according to the guidelines, they have wonder results on your weight loss, but yes, at the same time, they have a lot of side effects.
Yeah.
In last 2 years, it was used drastically.
Yeah.
This year, there have been 2 red signs on it, because the new drug has come.
Yes.
And now that drug is being used.
Yes, it is. Right.
But what we as a doctor and you being in media needs to do is that we need to educate our patients that you need to follow up with your doctor.
Right.
So that we also develop a database. We talked about Gilgit-Baltistan having stomach cancer, but why we have not been able to come up with
We
the
never
final cause?
documented it. Yeah.
Because we do not get the patient's feedback and follow-up. We as a country, owe this to everybody, that we need to follow up with our doctor, so
Right.
that, we have the right data, and then we can do publications, and then we will develop our own guidelines. Then we won't be needing to follow, any guidelines. You can see in India, now they've got their own guidelines.
Right.
In our country, we need to do this, and we need to develop this, so that we blindly do not follow what the
But you
international
would
public
be
is saying.
advising everybody, right, that all these drugs can have side effects and they can affect your gastric motility,
Yes.
and it's always better to go the right
Natural
route,
way, the natural
way. Then there are a lot of people, advocating these very fat diets like keto diet, for instance. It's full of just fats and fruit.
Inshallah,
Yeah.
I've collected a lot of data, and there's a paper publication as well coming. Keto diet, a cause of gallstones in
Exactly.
young females.
Very
And,
good. That's very much needed.
We've come across a lot of patients as well. And that again comes with the same thing, that keto, intermittent fasting, all these publications have been developed by the West.
On the Western population.
Yes, and their own population, their own genetics.
Their own makeup, their own environment.
Gallstones
Eugenics
are
and
very common.
eugenics.
Gallstones
So
are
what
very
are the common causes of gallstones? We missed that out. Let us talk about gallstones now that you mentioned it.
Genetics, family history, weight gain.
Fat, fertile female.
Fat, yes. Okay. Weight gain.
Right.
OCPs, pills and all that stuff. Drugs, abrupt weight loss. There are many causes of gallstones.
So how does gallstone, present?
Mostly a patient will come up with that he or she is suffering from pain in the right hypochondrium in the part of the liver.
Okay.
Postprandial, that is after eating. There might be jaundice, there might be fever, there might be nausea, there might be vomiting. There are a lot of signs of gallstones. But mostly it's an incidental finding. You went to a GI doctor, she advised you an ultrasound, you've got gallstones. Fortunately, 80% gallstones are asymptomatic. 20% are symptomatic, that you might be having symptoms. The symptoms are always worse. Jaundice, pain, fever.
Thank you so much, Dr. Umar. Thank you so much for joining us today. We had with us Dr. Umar, who is a gastroenterologist and hepatologist, and he gave you complete guidelines how you need to take care about your gut. Be careful with it, be very cautious about it, and not just pop any pill that comes your way. Thank you so much for watching. Inshallah, we'll meet you next week. Allah Hafiz.